Hello everyone, I'm Dr. Iqbal Musani, MDS from Pune, India. I'm a pediatric dentist and a specialist in treating tongue ties for newborns, infants and children. Babies who are born with tied tongues are unable to breastfeed. This results in a postpartum depression in the mother. If the babies are given formula feed, they are deprived of the healthy benefits of the breast milk. Nursing and breastfeeding is a function in the early months or early stages of a child's life. However, untreated tongue ties will impact the entire quality of life, not only of the child, but of the entire family. At 6 months, these babies then transition into solid foods or different textures of foods. If the tongue tie is left untreated, these babies or these children now, infants and then toddlers, are unable to clear out textured foods from their mouths, and they don't try new foods, so they become picky eaters. They are unable to clear foods, so they tend to get more cavities, dental caries, which is a big problem. We've had patients who've come in with tongue ties who are 3-year-olds and 4-year-olds and who are eating pizzas, and they keep on digging their fingers into the mouth, into the molars, and trying to remove all the food. These children, they are not able to lick onto the ice cream cones or even lick onto a lollipop. They cannot play wind instruments. So these are basic functions of life which are impaired then. Moving forward, when this child is with the tongue tie, unable to speak clearly, most of the times parents come to us and tell us that, we can understand our child, but the outsiders don't understand their children. Children with untreated tongue ties have difficulties in sounds like sir, shur, ter, thir, der, gn. So gn and ng, sing. These kind of dual sounds are difficult. They cannot say la, 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 la. They cannot say drrr. So these are difficulties which children have in speech if the tongue ties are not treated. Moving forward, it also impacts the growth and development of the child. When the child is growing up, you have got small sized jaws with crowded teeth. So these kids are with a lot of malocclusions. We sleep every day. We breathe every day. Even these functions are impaired or impacted because of an untreated tongue tie. It starts with mouth breathing. So babies with tongue tie will open their mouths and breathe through their mouths. Then it becomes noisy breathing. Then it becomes snoring. And then ultimately this leads to a full-grown adult with sleep apnea. So a tongue tie is a predictor or a factor which tells us that as an adult, this adult will have sleep apnea issues. Again, the sleep component. So a lot of these children, when they are growing up, even though they have an adequate quantity of sleep, they do not have a good quality of sleep. These are restless children. They wake up tired. They get tired easily. They are not able to concentrate properly. So these then are labeled as ADD and ADHD or attention deficit children, and then ultimately into sleep apnea patients. So we say that untreated tongue ties will have difficulties in breastfeeding and nursing, but it also impacts speech, sleep, swallow and breathing, which we do 23,000 times in a day for the rest of our lives. In our practice, we use lasers to correct lip ties and tongue ties.